Good evening, ladies and gentlemen. Welcome back to Tips from Back to Health Physical Therapy. My name is Dr. Michael Goynatsky, and I'm a treating doctor in one of the facilities. Today, the topic or the question that we're going to talk today about is sciatic pain and exercises that you can do when you experience that kind of problem. Let me just real quick just introduce what sciatica again, or review if you did watch or follow our nightlight videos every Tuesdays. So basically, really quick, sciatica is a problem that comes from the herniated disc, from the spine level L5 to S1, and sciatic nerve is the largest nerve that come out of the level of the spine, and it can be compressed or disturbed at that level when two roots come out of the spine. Sometimes you can get inflamed, sometimes you can start having the shooting pain going down your legs. And in order to treat it, or what types of exercise you can do in order to prevent or make the symptoms much less. And let's talk about them a little bit. When the sciatic nerve goes down your leg, it does affect the muscles of your hips, going down all the way down towards your feet. And one of the major muscles that being involved is the muscles of your buttock area, because the nerve is running right under one of the muscles that calls piriformis. And one of the symptoms as well of the sciatic nerve is not just the shooting pain down your leg or numbness. It's always tightness of the leg, of the muscle of your buttock area. So let me just show you a couple of tips or a couple of exercises that you can start doing at home in order to prevent or to decrease the amount of pain that you experience in your hip. Okay? So first thing first is to the exercise is called piriformis stretch, and in order to decrease the tightness of the muscle that eventually can compress that nerve, if you keep that muscle stretched or loose, it might decrease the amount of pain that you experience. And let's pretend that you have sciatic pain on your right side. So you're gonna lay down on your back. You're gonna have your left leg or left knee bent. You're gonna put your right leg in both side over the top. Take both of your hands either above the knee, make sure you don't have any problems with your knee, or behind. And I want you to pull it all the way towards the opposite shoulder. So make sure you don't pull it towards your chest. Make sure you actually pull it right towards the opposite shoulder, because whenever you stretch your muscle, you want to make sure that you stretch it along the line of the muscle fibers. So whenever, if you can appreciate in the picture, the piriformis muscle over there is actually a little bit diagonal. So to get the perfect stretch, pull it right across your chest towards your left shoulder. Okay, and you can hold it 5 to 10 seconds, 10 repetitions, 2 sets of 10. Another one, another good exercise that you can also do is, and before I show it to you, I want you to kind of appreciate and try to understand how the nerves in our body works. Let's pretend that we have this one straight line, right? Like this. So pretend this is a nerve, and it lies along. In our case, if it's sciatic nerve, it runs right on the back. So at some point, if it's being stuck or being compressed by the muscle tightness, it's no longer will be gliding, because whenever we move, the nerves move with us. So at some point it might be stuck somewhere. So it's very important to make sure that the nerves is nicely gliding along our body, along our muscles. So one of the exercises called sciatic nerve flossing or gliding, where you try to stretch the nerve, and whenever you want it to loosen up and make sure that it's mobile and moving along your body. Okay? So let's say, again, for the demonstration purposes, pretend that you have your sciatic problem on the right hip. You sit down, make sure your legs are off the table, and you can put your hands behind, or you can put them in front of you, and you're gonna straighten up your right knee, and you're gonna pull your toes up, and at the same time you're gonna look up into the ceiling. And simultaneously you wanna move your leg down, and you wanna move your head down. So knees straight, toes up, head down, knee down, leg down. So basically what we're trying to do, we're trying to floss or to move that nerve in order to make sure that it glides along our muscles, okay? That's another way to decrease the amount of pain or pulling that you experience due to sciatic nerve or sciatic nerve inflammation. And number 3 exercise, what you can do as well, pretty similar to the flossing, when you're gonna sit down on the bed or on the floor, knees straight, pull your ankles forward, put your hands behind, and what I want you to do is you're gonna bend your leg, bend your head forward, hold it 5 to 10 seconds, and slowly come back. Put your head down, slowly come back. Keep that in mind that you won't be able even to get into that position. Sometimes patients with sciatic nerve have so tight hamstring that you actually just won't be able to put yourself in that kind of position. So do it step by step. Just sit down. Let's pretend you can't straighten up your knees. Start with this kind of position. You need even to put your hands behind if it's too much. You can put it right here. Move your head down. Let's say start with your toes. Okay? Get it to position and hold. But ideally, you want to make sure that your knees straight, your toes pulled up, and your hands behind, and you lean forward to get that full stretch of the sciatic nerve. Thank you for listening. Again, if you have any questions, please text us or share or ask questions on Facebook. Make sure that you follow the tips, and if you guys have any more questions, please follow up. And thank you for listening. Come back to Health, and we definitely will bring you back to health. Thank you.